How do you do? My name is Tammy Lockhart, and I'm going to present our project, Our Medical Records, on behalf of myself and my partner, Robert Brown III. So, to help us with our presentation is my friend Taro. So, Taro, like most of us, has a primary care physician. Her primary care physician has a lot of information about Taro, mainly in the form of paper. Taro also has a specialist. And again, the specialist has a lot of information, mainly in the form of paper. Tara has also had occasion to have surgery at the local hospital, so the local hospital has information about Tara, including pictures, notes, and data. Tara's had imaging ordered by her doctors, MRIs and CAT scans, so this local organization also has data about Tara. Like most of us, Tara has had some prescriptions from time to time, so her local pharmacy also has information about her. And also, her insurance company that pays all her bills, they have information about Taro. So, traditional world, this is all in paper, it's all separate islands of information, no one exchanges anything. So now electronic medical records come along, everybody's going to go electronic, everybody's going to exchange data, except it's not really clear how this is going to happen. So, let's explore this. Taro goes to the specialist. Well, the PCP really is supposed to have all those basics about Taro and serve them up electronically, I guess, to the specialist. Meanwhile, the specialist is going to generate information that needs to come back to the PCP. Taro then has to go to the hospital, so the hospital's kind of expecting to get some basic information about Taro from her doctors. But, on the other hand, once Taro's done at the hospital, there's going to be a whole lot more data generated that her doctors would like to see. And oh, by the way, if there's any kind of imaging or pictures ordered, this needs to be sent around. And then finally, now the prescriptions could be sent electronically to be put in the records. But to me, this kind of looks like a very bad idea for us how to exchange data. It seems inefficient and fraught with problems. So what Robert and I are proposing is to create, for the patient, their own private data warehouse. This would be a secure system. So the way it works, Taro goes to see her primary care physician, copies of the visit and the information are obtained and placed in her account electronically. She goes to the specialist, again, copies of the data are converted into electronic format added to Taro's records. Taro goes to the hospital. All the information from the hospital, including the imaging, now added to Taro's records. Taro gets more MRIs and CAT scans. All goes into Taro's record. Taro gets prescriptions. All goes into Taro's records. And all of insurance bills now are easy for Taro to find and easy to match up with visits and what was billed and what was paid, which is the double check we really need in the healthcare system to let the patients get educated about what's being billed. Then Taro goes on vacation, and the beauty of this is that because Taro pays a subscription for her accounts, she can grant access to her doctor who doesn't have to pay anything here in this lovely tropical island where she injures herself. The doctor now accesses Taro's records, knows Taro's medications and Taro's history and allergies, has complete information. Data generated at this visit now goes in Taro's records. Taro goes back to the PCP for follow-up. All the information from this hospital is now in this central data, and all the PCP and the specialists and even the surgeon at the hospital are now looking at all the data. It all is the same consistent source of data, and it's actually managed by Taro, who gets to double check to make sure she understands the info, and obviously add in, things like supplements and vitamins and things like that that only the patient could do. So this is our project. This is what we're proposing. We think this is really important. The Obama administration is spending buckets of money on all this exchange, and none of the patients not in the conversation at all, and our data is going all over the place. We think it's really important. We're building this in Java. It's open source systems, open source platform. The data will be encrypted before it goes in the database, negating the need for an encrypted database. This is also part of what the pilot will prove, that this is a secure approach of how to do this. and we really want to be able to have the resources to test this fully, but we really think this is the way to go and that everybody should care about this. So that is the project plan, Our Medical Records. I am Tammy Lockhart. My partner is Robert Brown III, and I thank you very much for your time and attention.